Burns are a common occurrence in any household, but there is a definite increase in burn injuries as soon as cold weather sets in. Out come the heaters, paraffin lamps, hot water bottles, and those microwavable heating devices. And with that, the risk of burns increase substantially. Of course, prevention is key. But what do you do when the worst happens? Well, here's a scary statistic for you. There are about 1.6 million burn cases in South Africa every year. Children under 6 years of age are most at risk, followed by infants. Now, according to the Red Cross Children's Hospital, 90% of all burns happen at home, and the majority of burns at home happen in the kitchen.
Common causes of burns in South Africa are hot water burns. We see a lot of domestic incidents where boiled water is unfortunately pulled onto kids or even adults or disabled people for that matter. And then flame burns we see quite a lot of, particularly in informal settlements where there's a large number of injuries, usually when there's a spreading felt fire. Other causes would be more industrial related or work related injuries with hot tars, polishes, oils, that sort of thing.
The severity of burns vary. First-degree burns are generally not too serious and only involve the top layer of your skin. Second-degree burns are more serious and can result in redness, pain, and blistering. While third-degree burns are severe, affect deeper tissue, tendons, and muscles, and can cause charred skin that may be numb due to the nerve endings being destroyed. Now, when an accident in the home does happen, understandably, most people will go into shock. And if you are not a trained medical professional, it'll be hard to identify the severity of the burn at first glance.
When one is burnt at home, the very first thing you should do is cool the burn. Ice, running cold water for at least 20 to 30 minutes over that area, regardless of the cause. Remove the burn agent, so whether it be hot oil, whether it be hot water, whether it be a hot utensil or anything of that matter, try and get it off as quickly as possible, but very importantly, cool the burn as quickly as you can.
The same way we make sure to have emergency medical kits in our cars and homes, a basic burn kit is also a must.
We advise parents in particular to keep some burn shield in their fridges, and that would go on the burn. Whatever you do, don't put on any toothpaste, any kind of food products. There are lots of myths out there. There are lots of what we could call old wives' tales. Just ignore all of those because they just make it worse.
While most first and second degree burns can be treated at home, more severe burns require immediate medical attention.
The deeper the burn wound, the more likely it is to become infected if not adequately or quickly treated, and dead tissue removed on time, and the wounds kept covered with appropriate antibiotic or antibacterial or sterile dressings, as we call them.
Winter is unfortunately known as burn season in this country. Ideally, there would be no accidents. So here are a few tips on what you can do at home and in your daily life to make the environment safer for your entire family. Establish no-go zones at home to ensure kids stay away from any open flames and any hot surfaces. For example, when cooking happens, the kitchen should be a child-free area as far as possible. When you are cooking, make sure that pot and pan handles are turned towards the back of the stove and use the back plates when possible. Make sure to test the temperature of bath water and food before subjecting children to it. Make sure your electrical cords and outlets are safe and in good working order. Never leave appliances like heaters unattended. And also remember to check buckles and straps on car seats if the vehicle was parked in direct sunlight. And make sure that any flammable liquids or materials are safely stored away at all times. And if you are going to take anything from today's program, please make sure that you and your children have a healthy respect and understanding of where and when burns can occur, and that you have an action plan if anything should go wrong. Wishing you a warm and burn-free winter.